but she doesn't think she can afford the premiums. Throughout the country, the people have spoken out. And one state where this is key, when you look at the states that use the most of these plans, it is Texas, it is Florida, and it is the state of Georgia. And just by coincidence, we have the great senator from the state of Georgia, Raphael Warnock, joining us today.
A happy coincidence.
Thank you so much, Senator Klobuchar and Leader Schumer. After today's vote, I really only have one question. Who do the Washington Republicans work for? Who are they working for? First, you kick 15 million Americans off of their health care in order to give billionaires a tax cut. And then after doing that, you double the premiums on some 22 million additional Americans. For some people, you triple the premiums, quadruple the premiums. Who are you working for? These are people who are disproportionately in red districts. And we have tried time and time again, as my colleagues have said, to get the Republicans to make a different choice, and here we are today. 15 million Americans have lost their health care. 22 million Americans on average will see their premiums double. Just last night, I had to stand up and object to a UC that would have knocked an additional 1 million people off of health care. And my colleague, who was putting forth that proposal, like me, he lives in a state that has not expanded Medicaid. And so here we are. The Republicans have demonstrated who they are working for. Certainly they're not working for you. They are not working for the people of Evans County, Georgia. I was there a couple of months ago. This is a county that voted overwhelmingly for Donald Trump. I won Georgia. I did not win that county, but I was there because I represent those people. They've already lost their labor and delivery unit, and they may well lose their ICU with these draconian cuts to health care. And so we've got to find a better way forward. We know that the status quo certainly has its problems. There's nobody who's saying that health care in America is terrific. But Republicans today have taken a system that's already struggling and broken it down even more. And the consequences for ordinary people, many of them in their own red districts, will be that they will have to delay response to their health care. They will have to find a way to pay more, higher premiums. And for many people, they will literally pay with their lives. And so we're not about to give up. We're going to keep fighting for those people. I've gotten arrested not once but twice fighting for health care. Dr. King said of all the injustices, inequality in health care is the most shocking and the most inhumane. And we're going to keep working at this until we center the people and get them their health care and their human dignity back.
Okay, questions on this subject? Yes.
Leader Thune says you're making this a political issue. These votes on the floor make it clear that a clean extension does not have a path forward. Neither do just reforms without an extension. So are you open to both?
Leader Thune ought to start talking to the American people. When your health care premiums double, when you can't afford medicine, when you have to switch doctors who's been on your case for so many years, that ain't